Sego and welcome to Onkwarihwa'shòn TV. Today we will be talking about the recent Moderna vaccine that's arrived in Onkwarihwa'shòn this week. And we're also going to be talking about the coronavirus and the impacts that it's had globally speaking. So over the past year, most of us have learned more about the coronavirus than we ever imagined that we would. And throughout 2020, this virus has swept across the nation, across the globe, affecting more than 78 million people. Meantime, scientists worldwide have raced to develop a safe and deployable effective vaccine against the illness, and in record time. This week, the Moderna vaccine, as I mentioned earlier, arrived in Onkwarihwa'shòn, and no doubt community members have many questions. I'm sure you guys are all getting them already. So joining me today to discuss the vaccine and COVID-related issues is Dr. Ben Kelly with the St. Regis Mohawk Tribe Health Services and St. Regis Mohawk Tribal Chief Beverly Cook. Welcome, you guys.
Thank you.
Thank you.
So can we get an update on the vaccines that just arrived in Onkwarihwa'shòn this week, and what kind are they and how will they be distributed?
The ones that we obtained are the Moderna, M-O-D-E-R-N-A. They are the messenger RNA vaccine, which is a new type of vaccine. The thing that sort of caught us even a little bit off guard, I do not think they were available until around midnight Saturday, and we actually got them delivered here on Monday. I mean, we were sort of shocked how quickly it got here. But so we got 200 doses, and we are now getting the last minute plans in order to start giving the vaccine. And we're starting out with a list that the CDC came up with. You're probably going to ask the question, but in the first batch is supposed to be going toward healthcare staff, first providers, which I think in our opinion include police officers, EMTs, ambulance, most people who work here at health services, and I think we also are including the 2 tribal IRAs that hold disabled people as well as the staff there.
So far, what has the reaction been from staff members who have received the vaccine?
I guess maybe I'll just start out with myself. If you would have asked me, say 4 to 6 weeks ago, are you going to get the vaccine? I was really on the fence. I was not sure. Since then, it's been given to multiple places around the world. There have been very few, if any, I guess what I call serious side effects. And it seems to be more the scientists are more and more happy with the results. And if you watch TV, you see all the politicians and Dr. Fauci and people are getting it. So at this point, I have no doubt that I would get it. If it was in front of me right now, I would get it. I would certainly want my family to get it when it's their turn. So the funny thing is, we initially put out a request for staff, and I have to say I was a little disappointed the number's low, but every day more and more people are contacting us and said, is it too late to get on the list? So we are now, the last I heard, well over 100 people are ready to be in that first batch.
And Bev, what do you think, what are some of the reactions that you're hearing about with regards to the vaccine arriving in Onkwarihwa'shòn, and what are some of those, the feedback that you may be getting filtering down to you?
I think the feedback was the same. I mean, I'm in the same as Dr. Kelly. When you heard about Operation Warp Speed and that they were going to be flying through this process, I was concerned about it too. But the more that you learn about it, the more confident you are that they've actually been working on this type of vaccine and have been working with other coronaviruses previously. So once they got the code for the actual virus, and with all of today's technology and advances in science, that it makes sense that they were able to develop it so soon. So the more that I learned about it, the more confidence I gained in the vaccine itself. And I think once I learned a little bit more about the mechanism of action, I became more reassured in terms of side effects and that sort of thing. But I think that the overall reaction is the same. The more that we start to see increases in our own cases in our own community, it seems that people are more willing to and anxious to get the vaccine. Not that that's a lot of numbers, but I see it increasing, and that people don't want to risk getting their mothers or their grandmothers or even their children infected is becoming, I think, their prime motivation.
Mm-hmm. Now, you make a good point. There has been a lot of discussion about the warp speed and more particularly about people feeling that they're not sure about the side effects. Based on your professional opinion, is there some validity to people not knowing what the side effects are? And what would you have to say about that, Dr. Kelly?
The one thing to understand that I had sort of failed to understand is if people think back several years ago, there was a thing called SARS and the Middle Eastern Respiratory Syndrome. Those were all coronaviruses. Since then, a lot of these labs have been working on this mRNA type vaccine. They didn't just start 8 months ago. There was a lot of basic research done, and they just really ramped it up once the COVID that we're undergoing. So certainly people are correct in looking at it a little bit with a jaded glance. I mean, you don't want to just take any vaccine on the say-so of somebody at the CDC or wherever. But I think at one point, it was really, everybody was worried that politics had come into it. And even though it did, I still think they did a good job. And I do think that the science is sound and it's going to be relatively safe. And again, I say relatively, all the early studies have shown that. A lot of time, by the time we get a vaccine, there is more safety information. This will come about when the time comes for people here to get the vaccine. There will have been hundreds of thousands of people throughout the world who have already gotten this. So those are my thoughts.
And I'm guessing too, obviously in the early stages of the vaccine being deployed, there are some well-documented side effects, but they're very limited, as you just said. But one of the other questions I had was, for those individuals who are anti-vaxxers or they're skeptics about the vaccine, what would be the pros and cons of getting it? Like, if you want to start there and look at, getting it versus not getting it.
I think that it lies in everybody's personal experience with disease. And I think that a certain generation has had the benefit of the MMR and the pertussis and the tetanus vaccine and polio vaccine, so that having to have a relative or a family member come down with any of those diseases has not happened for them. And so it's not something that they're used to seeing. What they're used to seeing is everybody's pretty much safe from those diseases. And then you get to focus on, I hate getting my kids vaccinated. And we all don't want that. But the reality is that there are diseases that cause great harm. And unless you've had a personal experience or a family member like myself, I have cousins who have long-term effects from having had polio when they were children. And I have a cousin who suffers disability from mumps and encephalitis, which you don't hear about anymore because of the vaccines. But knowing what their struggles are in their life and having a cousin she and her husband acquired COVID They both ended up in intensive care unit. She survived and her husband didn't. And that kind of reality really drives it home that this is not a game, this is not a hoax, this is not anything to be toying with. So I think that reality kind of influences how people think about not getting vaccines in general or not getting this particular vaccine. And it's understandable, but boy, when you get hit at home with the suffering that can happen, I think that changes your outlook on it. And vaccines are made in response to something terrible, trying to alleviate. I mean, if you ever saw a baby suffer with pertussis, you would hope that everybody takes seriously getting their DPT shots for their babies and so on. So it's hard to describe those things to someone who's never seen it, but I think we need to help protect each other. It's our own selves, we don't want to get sick, we don't want to die, we don't want to have long-term health problems because of acquiring COVID or any other disease, but I also don't want to be the one that spreads it to my children or my grandchildren either, or my mom.
Dr. Kelly, what are your thoughts around risk versus reward with regard to that?
I think Chief Cook makes a great statement about polio, for instance. Those of you who don't remember that, just ask your parents or grandparents about people who could not breathe and were on iron lungs and could not walk, and at a young age were pretty much confined to a wheelchair forever. And also pertussis. I mean, back in the 60s, we called it whooping cough. Boy, I mean, to see little infants cough to the point where they literally bounce off their mattress, you would never forget that. But it is a very difficult conversation because there are people who are convinced that vaccines can cause harm, that they have caused harm to their own family members, and I understand that. And there's really no way for me to talk them out of it, and I can quote scientific studies till I'm blue in the face. That doesn't, they're still looking at their family member who had a problem because of a vaccine. So it's very difficult, but I think we need to convince everybody who's willing to go through with the vaccine.
Maybe this would be a good opportunity for us to have a short discussion around how vaccines work exactly and the technology around them.
This particular vaccine uses a messenger RNA, which has encoded in it the code to make the protein that you see the spikes on top of the coronavirus. That's the attachment, that's the landing gear for the virus. So that it uses that protein to dock onto one of our cells in our body, and then it interjects itself into the cell, takes its RNA, transcribes it, and then starts making copies of itself from our own cells, because these viruses can't live without a host. They're like the body invaders. They need us in order to stay alive and to keep reproducing itself. So the messenger RNA is put into a little fat globule that's injected into the body. It enters the cell, and then the code tells our cell to make pieces of this protein, not the virus, but just the piece of the landing gear. And when it makes a piece of the landing gear, then our immune system recognizes it as foreign and sends out an army of lymphocytes or particles of our immune system to fight it. And then the messenger RNA dies. It degrades and comes apart, and our body is fighting the proteins. There's many different lymphocytes. There's helper cells like the T cell that it creates that responds doesn't really do anything itself. What it does is it calls all the other immune cells to come and to fight this foreign body. So they come and they do different things, but they have specific jobs to do. And there's one that remembers. And so that whenever this protein ever gets into our body again, it recognizes it, it remembers it, and it torpedoes it. And all the other immune system particles respond as well. And so then you don't get sick.
Wow.
That's basically how it works.
That's a great way of explaining it. And just, is there a difference between this vaccine versus others? Like, is it made differently? Is it developed differently?
Yeah, I think Dr. Kelly could talk about some of the other vaccines that they've used in the past.
The mRNA, it stands for messenger RNA, that Chief Cook was talking about, is the new way of thinking about things. The other vaccines that we all had, the mumps, the measles, the pertussis, tetanus, actually uses pieces and parts of the virus itself. Not a live virus, but part of it, so that your body pretty much recognizes it, as she said, stores all these memories, and when it does come, hopefully overwhelms it and you never really have the disease. The messenger RNA, you have no part of the virus injected into you. The messenger RNA is actually, as far as I know, made in a laboratory. It's just, the technology is just incredible. And when it goes into, so you get the injection, sometimes in a day or two you might feel some mild flu symptoms. That's your immune system being stimulated by this mRNA. We've all seen pictures of COVID in the little red, look like flowers that stick out of it. That's the spike, they call it. This is what we're trying to destroy, so the COVID cannot hook onto your cells. You know, when people call it a side effect, it actually isn't. It's sort of part of what's happening. It's stimulating your immune system, though many people have no symptoms. They never even knew they got it. You're just not getting any part of a virus, whether it's dead or alive or inert. It's nothing like that. And as Chief Cook says, the mRNA supposedly degrades over the first 24 hours, so it's gone. It doesn't hang around in your body.
So, for example, if I take the vaccine, would I still get infected? Like, there's some questions out there regarding that. Like, well, is it a way to protect myself from getting infected, or like, how does that work?
It'll protect you from becoming infected. That's the goal of it. However, if you come across somebody, say you meet somebody who has recently been infected with COVID and they're shedding the virus can still enter your body. You breathe it in. If you don't have a mask on, you could still breathe it in. And when you breathe it in, the vaccine will have primed up your immune system so that you won't become infected. But that doesn't mean that you couldn't carry it in your nasal passages for a period of time, go home, sneeze or cough, and then spread it in the house, and somebody at home might get it. So they're recommending that people continue to wear masks for a while, and to take all of the same precautions so that they don't pass it around, even though they may not become infected themselves. So that's a concern. And I think until Dr. Kelly might be able to speak to this a little bit better, but until people are able to achieve the herd immunity that everybody's talking about, where enough people have become immune to it so that this virus has no place to go. Because without someone to infect, it can't continue on. That you'd have to get 75% of the people to become immune or vaccinated. It's it's not practical to wait for everyone to get sick and build up immunity, because then that's a game of saying, well, let's wait for everyone to get sick and see who lives and who dies, because the ones who live hopefully will have immunity. The ones that die, well, oh no. And that's just a horrible way to think about it, I think so.
The herd immunity is what everybody hears about. And, they say 70% need to be immune to any specific disease to have herd immunity.
Mm-hmm.
In order to get 70% without a vaccine, you're really taking the survival of the fittest to the extreme, where you're saying, okay, well, theoretically, people over 70 with diabetes and lung disease, we're going to sacrifice you so we all get immune. I know that's pushing it, but that's sort of what it is. If we could get theoretically 70% of the population to get the vaccine, we may hit that herd in a relatively short period. The disease could greatly decrease. But one thing I really want people to carry away from this is, even after you've had both of your vaccines, you still will need to wear a mask, wash your hands, stay distant. And I think most experts are saying probably right through till the summer. I know that's not what we want to hear, but Teresa Gardner was saying, somebody said, well, if I get this vaccine, then I don't have to worry at Christmas, right? Well, Christmas is only 2 days away. So that's not true. You still have to be very careful.
And I think that was part of my questions that you both just answered. There was a lot of discussion about getting the vaccine and then not necessarily having to wear a face mask and taking those social distancing measures in place, but also what would immunity be like, like when you're talking about the herd, the category or the percentage of people that would make up this category. You just answered the question too about, it looks more like we won't be seeing the long-term effects until maybe the summer. So it's not out of the ordinary though for this amount of people, I would imagine, that have been affected, across the nation. So with that being said, we're going to wrap it up, but do either of you have anything else you think is important to add before we head out?
I would just like to say that the other piece that people need to be aware of when they talk about, COVID has this big, huge percentage of people that recover. So why are we getting all excited because most of the people recover? I think that there's still more to be learned about that, because there's people who have recovered that have scarred lungs and still have difficulty breathing, or they still, even though their sense of smell and taste came back, which are cranial nerves, by the way, that they haven't always rebounded normally. So there's still some things smell different than they used to. People still have problems with fatigue. There's young people that have subsequently had heart damage and strokes. So there's a lot to learn about what recovery really means when it comes to COVID-19 and what those lasting effects are.
Okay, now Bev.
Mm-hmm.
Dr. Kelly?
I feel the same way as far as the chronic lung problems, the fatigue. People also, I luckily haven't seen anybody like this, but some people complain of like a brain fog. It takes them weeks and weeks or months to feel that they can concentrate and focus again. They're very vague, but it takes a while too. You don't just get it and 3 days later you feel better. It just doesn't work that way usually. So. Okay.
Well, thank you both so much for joining us today. It was a great topic, a lot of discussion that people are asking questions about, and hopefully this discussion will help answer some of those questions to community members. So Nyawa Goa for joining us. Appreciate your time.
Appreciate it, Nyawa.